Hello everyone. This presentation is on Yin Chen Hao Tang, also called Virgate Wormwood Decoction. It is on the California Acupuncture Board Herbal Formula list. I will briefly review the traditional pattern, a hypothetical patient, 3 possible drug-herb interactions, and a practical management plan. The goal is to connect traditional Chinese herbology with modern medication safety in clear student language. Traditionally, Yin Chen Hao Tang belongs to the category clear heat. A representative pattern is damp heat jaundice with yellow discoloration, thirst, and abdominal fullness. Important ingredients include Yin Chen Hao, Zhai Zai, Da Huang. In practice, the formula should be chosen by matching the full pattern, not simply by matching a biomedical diagnosis. I would also screen for red flags, confirm that urgent medical care is not being delayed, and review all medications, supplements, and over-the-counter products before recommending treatment. My hypothetical patient is 59-year-old man with hepatobiliary damp heat pattern after physician evaluation. The current medicines are furosemide, digoxin, metformin. This case gives a possible reason to consider Yin Chen Hao Tang, but it also creates interaction questions. I would document tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about kidney or liver disease, bleeding history, pregnancy status when relevant, and prior reactions to herbs or supplements. Medication reconciliation is essential because many clinically important interactions come from the combined physiologic effect of herbs and pharmaceuticals. Interaction 1 is Da Huang plus furosemide. The mechanism is that laxation plus diuresis can worsen dehydration and electrolyte loss. The clinical significance is moderate to high in older adults. My management plan is monitor hydration and electrolytes and stop if diarrhea becomes significant. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 2 is electrolyte loss plus digoxin. The mechanism is that hypokalemia increases sensitivity to digoxin and may raise arrhythmia risk. The clinical significance is potentially serious. My management plan is avoid unsupervised use in digoxin patients and seek medical review if weakness or palpitations occur. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 3 is Da Huang plus oral drug absorption. The mechanism is that fast intestinal transit may reduce absorption of oral medicines. The clinical significance is moderate for important oral drugs. My management plan is separate dosing from essential medicines and keep the course short. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. In conclusion, Yin Chen Hao Tang may be reasonable when the patient truly matches the pattern damp heat jaundice with yellow discoloration, thirst, and abdominal fullness. The safety question is not whether herbs are simply safe or unsafe. Risk depends on the specific ingredients, the product quality, the dose, the treatment duration, the patient's organ function, and the medicines being taken. I would start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is educational and does not replace individualized medical care. Thank you.